my life. I feel confident about myself. I feel confident about the things that I wear, the things that I can now wear that I didn't feel I could wear before, and just my whole attitude. I believe it presents a more positive personification of me.
At the time I made the decision, I was about 67 years old, and I'm in a young man's industry, commercial real estate. So you're meeting with clients all the time. And it's important to have a vigorous look.
I wanted the works, and in doing that, obviously it took quite an investment, but that's exactly what I took it for, was an investment. It was an investment in my life. It was an investment for me.
It makes me feel great to be active, to get outside, to enjoy swimming. And you know, I'm a 54-year-old man, and so I don't look like a 24-year-old man, but I feel perfectly comfortable. I fade in with the rest of humanity, and it's just a great feeling.
This is the story of 3 women who decided they could change their lives by undergoing major plastic surgery. Christine is a 42-year-old woman who lost 160 pounds after gastric bypass surgery. The massive weight loss left her healthier and slimmer, but also left her with large amounts of hanging skin.
In the early 1990s, I gained about 160 pounds over the course of about 3 years. And it was so fast, and it was through a serious tragedy that had happened to my children's father. He died. It was just unbelievable. I actually gained close to 50 to 75 pounds a year. By that time, you know, the doctors had suggested gastric bypass surgery, which was huge to me. I, didn't know much about it. I had it done in 2003, December of 2003. I lost the weight, and it just fell off in about 6 months. I had lost 155 pounds. I never in my wildest dreams imagined that I would be so happy to lose all the weight, but feel so down because in my new marriage and lifestyle, I'm unable to really be fulfilled with my lifestyle. Living on the water, wanting to swim, wanting to boat, wanting to lay out by the pool, I just don't do it. I'm thoroughly embarrassed.
Because to me it feels like it's about 200 pounds, but I don't even weigh that much anymore. So.
And really, thought, at first that, through working out and losing more weight, that a lot of it would kind of disappear. I'd build more muscle, which would fill up the skin. And what I found was, by going to the doctor, that a lot of that excess skin really needed to be removed.
I see the conflict within her. She grew up in Florida, and she's a water skier. Can't do any of those things, really. So I feel for her there, and it sometimes produces a mild tension between us because of just the things that I want to do, and I don't want to leave her behind, so I wind up not doing them sometimes.
When everyone else is swimming or water skiing, I'm so depressed because that's me. It's like I'm inside this body trying to escape. And that's where I think that plastic surgery is just such a wonderful option to me, because I think the results would be so significant and so drastic to me that it would enable me to live the kind of lifestyle that I want and be able to go swimming and be able to not be so self-conscious.
There is a bit of a fear that after all of this, what happens if it's not successful? It really isn't a concern that she's in any danger. I'm not worried about that as much as worried about will the outcome be such that it'll be worth it all.
Trish is a 41-year-old woman who could not regain her petite figure after her second pregnancy, despite her very active lifestyle as an exercise instructor.
The decision came about as I have worked very hard over the last several years to lose weight and to get my body in shape. I eat right, I do everything right. However, after 2 kids back to back, the sagging skin that occurred during especially my second pregnancy just will not go back. I am going to be having a breast augmentation with a breast lift, along with a tummy tuck with some liposuction. Pull the skin down, get rid of my scars from the C-sections and the myomectomy, because like I said, there's where I have a lot of the extra skin just sagging over that scar. And again, I can do stomach exercises till the cows come home, and that is just never going to go away without a procedure such as the tummy tuck.
I'm excited for her. It's kind of nice. She's had some body image problems ever since our first child was born, so I'm hoping this is going to give her some confidence, and I'm excited for her.
I anticipate that the recovery for me will go very quickly because I am in pretty good shape, and I feel like I've kind of been down this road before. But I know I'll have to take it easy at least the first couple of days, and then really watch the weight training and stuff for about 6 weeks.
Where are you teaching at?
I'm teaching up in Georgetown.
Oh, are you? Yeah. So I got the kids, obviously.
No, I was going to take them up to my parents.
Oh, are you? Okay,
yeah.
Cool. I love taking care of the kids. I'm Mr. Mom on the weekends, so you know the kids aren't going to be a problem, and I'm sure Trish will be laid up for a few days or weeks, however long it takes. But that's okay. We'll make our way through it.
And Jessica is an 18-year-old woman who gained a lot of weight and got severe stretch marks from her pregnancy at 15 and has been unable to get back the body she used to have.
I just graduated from high school last year. I graduated a year early, so this will be like my senior year. That's why I'm in cosmetology school. And I'm 18 years old. I had Manny 3 hours before my 16th birthday. Yeah. I was so young, and I was like a child taking care of a child, and I was still in school, and I didn't know where I was going to go from there, and it was just really hard at the beginning to have a little boy and have to take care of him when I wanted somebody to be taking care of me. Having a baby changed everything. I was really thin. I had like this great body. Everything was toned. Everything was in its place, and everything's just like wrong. I have a lot of stretch marks. Everything sags, and it's just I'm really young.
It's 3 years. See.
We talked about it a lot. It's something that she's wanted to do for a while because she wants to have the body she used to have. I mean, we go out to the beach to Fiesta, Texas. She can't wear a bathing suit. She can't, show any part of her. And I love her body.
It's just I'm not used to my body right now, how I used to be before. And it sucks that having a baby changes everything. You're not normal anymore.
So I think this will give her a lot more self-esteem. She'll be more confident, and she'll be able to have fun the way we used to have, and won't be so concerned about how she looks. Yeah, I got the first 3 days off. After that, my mom will be staying with you.
Okay, I'm scared.
You scared?
Yeah, I'm just nervous. You just kind of get all deformed, and it's not something you could do with exercise, because when you stretch so much, as much exercise you do, it won't never go back. And it sucks because you work so hard and nothing happens.
I'm ready. I'm just real emotional. This has been such a long process through losing weight, and it's been years. So I'm just I'm excited. I'm nervous. I can't even tell you how long I've waited for this day. So I'm sorry. It's just it's hard to believe that it's here, and I'm just really emotional.
I'm going to give you some Valium. It's 20 milligrams of Valium. It's a fairly hefty dose, but it's going to relax you very nicely. Okay, so the other two are Decadron, which is a steroid, and what we use those for is in hopes of helping to minimize some of your swelling after surgery.
We give patients Valium until their speech is slurred, and then we give them ketamine, a hallucinogenic drug, which sends them off into dreamland so that they feel nothing, know nothing, care about nothing, but yet all of their reflexes remain intact. Now, general anesthesia and opiates, narcotics, depress all the body's functions. And that's how it shuts the brain off so it doesn't feel pain. In this case, all the body functions remain intact, but the thinking ability goes off into dreamland and has pleasant dreams because of the Valium, the tranquilizer we gave them.
We're giving her the Valium. And we just give a little bit at a time. And what we're looking for is that two different things that sort of clue us in that she's had enough Valium. We're looking for nystagmus. What nystagmus is when the eyes twitch like this. They'll twitch, 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 twitch. And then the other thing is the speech gets slurred.
What day is it?
Do it. Let's see.
We have a blunt cannula with a blunt tip. So that pushes aside the arteries, nerves, and veins just as my fingers are pushed aside and not hurt at all. The holes are on the other side. They're also blunt. So the arteries, nerves, and veins just roll right over them like my fingers are rolling over. The amorphous fat, however, that's like Jell-O, gets sucked into the hole and it gets sheared off. So as we go back and forth, the fat gets sheared off. Well, as you can see, this side has been reshaped and tacked up. We'll close these, of course, all nice and neat. But as you can see, she no longer has the wrinkles, and this circle is in the center of this circle, so that this looks pretty cute. Here's the other side that we just have made the outlines in what we're doing, and you can see the tremendous difference in the shape of those breasts. They're actually both the same size. Since gastric bypass and lap band has become popular, we have seen hundreds of patients we otherwise would not have seen. Bleeding, and now we're going to bring the belly button right up here. Now the belly button's actually in the same place it always was. The difference is we've pulled this down like a vest over pants. And so we're going to close it just like that. These are the suture strips that we put on to keep this wound closed. It supports the skin. And these are drain tubes that go underground so that any fluid that's in there will drain out. It's important for the next couple of days, maybe even a week. And these suture strips hold the wound edges right together so that we minimize the fibroblastic jumping distance so that the two wound edges will fall in love and become as one. Yeah, well, we have you bent over so that we don't put tension, on that wound, because we've got it as tight as it can go.
Stay bent over.
You're almost there.
One of the beautiful things about this kind of anesthesia is the fact that people don't have nausea and vomiting afterwards, and when they wake up, they wake up. And she doesn't feel a thing. How amazing.
I'm in pain. The hardest part was when I got out of the car and I took 2 steps and Kevin was here. And Kevin just picked me up and put me in the I couldn't walk.
So this is day 3. She's still in a lot of pain. She has, her chest is in a lot of pain. Right now she has a bag of frozen peas on her chest.
My sister and my mom have literally been up every 2 hours with me. Taking me to the bathroom, repositioning me. So this is tough. This isn't something that you can do by yourself without, you really need a team. I have a relief team coming in an hour. And so it's a lot more painful than I thought. And I think if you don't have help, you're screwed.
The first 3 or 4 days, I was basically out of it.
Well, everyone is different in the way that they recover. It's not easy, depending on what procedure you have done.
In that recovery period, they give you some good sedatives and you sleep a lot.
The pain, yes, it did come with pain. Again, with any procedure, what surgery doesn't.
The next 3 or 4 days, I had some discomfort, but was taking pain pills and staying home because I looked like I had been in one heck of a fight.
This is 20 milligrams of Valium.
Okay.
It's going to make you sleepy before your surgery so that when we take you in there, you're already got some sedation going on. This is just normal saline. We're going to just give you, start your IV so that we have a place to give you all your medications when we get you back to the OR. Ready to go. Straight across the hall here.
The bathroom and
again. Oh, I'll take care of that.
How we doing, Trish? You ready to go?
Yeah, I had a nice little nap. I'm feeling all refreshed, ready to rock and roll.
We are doing about as much as we can do at one time. We're going to do liposuction, not too much, but some around the edges, a tummy tuck, a breast lift, and a breast augmentation. The mommy makeover. It makes such a difference for these folks. And the amazing thing is we can do it all under local anesthesia with heavy tranquilizers. We inject fluid that contains xylocaine, a local anesthetic, and adrenaline that causes the blood vessels to shrink down. In addition, the high volume of fluid that we put in squishes the blood out of capillaries. After we've been working for a while, a little bit of blood does come out with the fat. Oh man, she's so light, that wasn't even an exercise, huh? Stop a little short. This is called a cookie cutter. It cuts a perfect circle around the areola. We're going to make her areola smaller and we want it to fit the pattern, so we cut a perfect circle there. This is called de-epithelialization, where we're just taking off the top layer of the skin. And then we'll get down and start on the tummy right after that. Well, we first of all made the incisions in our pattern and then lifted the skin up separate from the breast gland itself. The breast is still attached to the nipple during all this time. We lift the breast tissue aside to expose the muscle underneath, and through that muscle we make a little tiny separation of the fibers so we can create our pocket. The pocket then is as big as the implant. Put the implant in, blow it up, close the pocket, that is the stitches in the muscle. Put the pain pump in. This will drip Novocaine here, xylocaine, for the next 3 days, so it will keep it more or less numb during that period of time. It's a wonderful advance in post-operative pain control. So we split this in half so then we can have gravity working for us as we take the excess off to the side. We've trimmed off all the excess skin so that she now has no stretch marks here. And we've pulled that all down as an apron, trimmed it off, and brought her belly button through a new place. In fact, she won't be able to stand up straight for a week or two because we have taken it down so tight.
Good morning.
Good morning.
I'm going to take you back into another room here so that Dr. Ursic can come and sit down with you. We're going to go over the consent one more time and make sure that we understand everything that we're going to do today, okay? So if you follow me, we'll go this way here. Perfect, perfect. Let me have those.
And stand up here. And then we're going to mark our tummy tuck here. We're going to do a little bit of liposuction around the edges. Mark our tummy tuck, just where we're going to take this all the way down to here. Get rid of all those stretch marks. And here. Mm-hmm. Turn around. This procedure involves, first of all, liposuction to just change her shape and form a little bit. But we don't do liposuction in the area we're going to do surgery. Then we're going to put breast implants in for her through her axilla. So we make an incision in the armpit, lift the muscle up, and they slide right into a pocket. Hardly any bleeding. It's amazing. Then we will take off that apron of skin and fat, including her stretch marks, and make a new belly button for her. Okay, ready? Let go. And I'm now under the muscle, actually, creating this pocket with this spreader. These implants come in many sizes, as small as 100 cc's, less than your fist. And the biggest I've ever put in is about 900 cc's, which is almost a liter. But I have seen them 2,000 and 3,000 cc's. Just immense. Plus 30. Pull out. So I guess we don't have to write before and after on here.
After the tummy tuck, the getting back to full speed was probably a month to 6 weeks.
It was quite uncomfortable getting used to wearing the garment for 6 weeks, and they recommend you wear it for 6 weeks, basically 24 hours a day.
When you come out of surgery, there's this kind of surge of energy, almost a manic energy, and quickly I learned to kind of ignore that and just rest, because invariably 6 weeks later I'd go, why didn't you just stop and rest for a week? And I finally learned that lesson.
We're 3 weeks and 2 days. I am so excited because the results are more than I ever dreamed that they could be. The breast lift was fantastic. All the skin is gone from my stomach. I really I've already lost, I'm ready to put the bikini on now, but I'm really more excited about getting done. I'm feeling great. We're gonna do the second surgery a couple weeks early, so I just wanna get my bathing suit on. It's May, the end of May, and all the boats are out. Everybody's out in their bathing suits, and it's hard to recover. I'm in the house and I'm going stir crazy, and I'm letting all this healing happen, but I'm so, oh my gosh, I just want to show everything off so bad. So I'm really excited.
Well, how are you, huh?
Good. How are you?
You look gorgeous.
Oh, thank you. I love the belly button.
Tiny and cute.
I love this right here. I'm now putting on my clothes that I couldn't fit into.
Well, I pretty much remember going in the room and them washing me down, and then after that, I don't remember a whole lot until I got home and been having to go to the bathroom about every 10 minutes. I didn't have any, no nausea whatsoever, which I kept reserving. Everybody kept saying, oh, it's no nausea. And I said, well, let me be a testament to that after I'm through that. And it was wonderful. It was great. No side effects as far as that.
Last night was a little bit rough, but so far so good. I think she's awake as she's been since she got home from the doctor's office, which is good. And she's been moving around and eating some this morning, so hopefully she's on her way to recovery. But last night there were some points where, I thought, I'm not sure this is worth it, but that's within the first 2 or 3 hours, and now I'm feeling a lot better about it.
I just went from it seemed like being able to move around okay to just absolutely nothing in a matter of a day or two.
The urologist told us it was related to bladder retention, so she said there was numerous causes. Could be the painkillers, could be just the trauma from the surgery itself, but basically she wasn't able to relieve herself. So every time she sat down or laid down or put any pressure around her abdomen, it was putting pressure on the bladder and therefore just uncomfortable.
Are you feeling better today than 2 days ago?
Yeah. It just seems to move from one pain to a different kind of pain.
And what are the 2 different kinds of pain?
I mean, right now it's just my lower back.
Uh-huh.
And I think a lot of that's from standing up, and then something with my shoulder.
Oh, God bless you. Well, we think that'll all be better pretty quick. But let me take a look here. Oh, those sure look cute, huh? Yeah. Yeah. Well, unfortunately, that is just one of the things that sometimes happens. Having some stress down here causes pain and tension on the waterworks. Sorry. Now this will hurt for about a second. Sorry. Well, 2 seconds.
So now I can shower without worrying about it.
You can shower.
Even with the catheter.
Thank you. Say again?
The
Yeah.
catheter. even with the
Catheter won't hurt a thing.
We've had a secondary problem though, so I think the bladder retention and her losing sleep and not being able to eat and having a lot of discomfort probably set us back quite a few days though on the recovery itself.
It's kind of hard to think about, being in pain again and starting over and having surgery again. And so I'm just a little bit nervous about that.
Christine, today we're going to do a hip lift for certain and a possible thigh lift. And the thigh lift is going to be a medial lift, I understand,
Right.
if he decides that he needs to do it.
Right.
Well, first, while you're around here, I want to mark
The elephant skin.
where we're going to put this little extra dart back here for you. And I think if we can get right about there, hard to believe, huh? But we can actually take this much of this off.
Incredible.
Yeah, look down here. Look how nice this smooths this out. See if I take this up to here. Wow. Isn't that amazing? And we'll end up with a butt that's got a pretty smooth shape. And if we get enough lift, we won't make this dart, but I think I'm going to make the dart. Well, isn't Christine a perfect patient? For her to go from 308 pounds, she had a gastric bypass, lost about 100 pounds, and it's been several years. So she not only had that benefit of a big weight loss, but now she has changed her habits so that she continues to maintain that low weight. And most recently, she's down to 155. I would guess today we'll take about another 10 pounds off just in that skin and tissue. And what a transformation. I mean, she has gone from a great big person to somebody that looks really svelte. Voila! Let's weigh this, see what we have here. Take that. Well, this piece is probably 11 inches long by about 5 inches in width. So that should make quite a difference in her circumference. So we have pulled all this up, and at this point we have heavy 2-0 stitches in here taking most of the force. And then along the skin we put a gentle little 4-0 running subcuticular stitch that will go down here and just hold the wound edges together so that they kiss. If you just put regular tapes on there, they don't stretch, and so any swelling or motion gets transmitted to the end of the strip where it'll form a traction blister. So the ones we use, suture strips, stretch exactly like a piece of skin so that they can go to a third bigger in their size and still return to exactly where they came from. So the wound is always supported, but yet it has that extra accommodation. We've taken almost a foot of skin and fat out of the sides of her hips and brought them up for a true hip lift. And of course we brought some of the roly-poly from her flanks down too. Reshaped her buttocks so it has a nice shape, and I think she's going to be really pleased with this. And it's certainly about even from side to side. First wedge from the left side.
It was $8.95.
And what is the weight of the second one? You have it there?
$8.95.
You're kidding.
I absolutely the same.
We are on our way to a follow-up visit with the urologist. I had a urodynamics test done 2.5 weeks ago to see what my bladder is doing, or was doing at that point, which unfortunately was absolutely nothing. A nurse followed up with me a week after that, so that had been a week and a half ago today, and said, "We don't know if or when your bladder will ever awaken, so just keep doing what you're doing, which is taking medication and keep trying." On the upside of that, I have been able to do some urination on my own. It's just not consistent, and I can't completely empty my bladder. So the news, as far as I'm concerned, is better than the news I got the day of the test, but we're still having some issues and we're still not working properly.
Hello,
Hi.
Miss Karen.
How are you doing?
I'm good. How are you?
I am actually getting better. I just can't feel like I'm completely emptying, and it's just not consistent in that sometimes in the morning when I first get up, I can't really go, and I know I need to, but I'm getting enough out that in the middle of the night, I'm able to urinate enough to where I can go back to sleep and not have to catheterize in the middle of the night.
Okay.
And then in the morning, I will go, I'll try to go, and sometimes I get some and sometimes I don't.
I don't think it's a nerve thing. It's just a bladder not wanting to function due to pain and probably some narcotic effect on the bladder. I'm sure that the narcotics played a part in it, the narcotics along with the generalized pain down there. I don't know that anyone's ever done any specific studies to look at urinary retention related to narcotic use. I'm sure they have, because it's a known potential side effect. It's not a complication, it's a side effect. And I'm sure that had a lot to do with it.
4 days post-op?
4 days, huh? How you feel? Sobering up a little bit?
Yeah.
Uh-huh. Are you getting some rest?
Yes.
You being good to her?
Very.
Okay. Well, let's see what we've got. Put it right there. Let me take a look at this belly button here. Yes.
No, I don't hurt, baby.
Put one on going right down there. Oh, that looks great. But I expect to have a little bit of drainage out of these exhaust ports for the next couple of days.
Okay.
And that's good. It's better for the fluid to be out. Okay? See you then. You are doing great. Bye-bye. See you in a week.
Thank you.
I just feel like I exercise for like hours and hours, but I really haven't. I guess all the drugs I'm taking, but I don't have that much pain. I can't stand up for long periods of time. That's the only thing I can't do.
But she's doing real good. The first couple of days she couldn't get up by herself. Now she's doing a lot of stuff by herself, walking to the restroom, that kind of stuff.
I'm happy so far. I just can't wait till I could actually see myself good and not just have to look through the mirror.
Probably the worst pain ever. I think the trying to find a position to sleep in or lie down in is the hardest.
It's just, first few days are kind of painful. But we're getting there. She's doing a lot better. Getting in bed is the hardest. This is
That's
the hardest
hard
part. Oh. Getting up isn't so bad because I've got, somebody to hold on to, but getting back in bed when you've got that lifting motion, it just feels like complete burning on the incision. So that's the tough part.
Christine, how are you today, huh?
Good.
Feeling better?
Just very sore and icky because I'm on pain medication and just not the right day.
Well, don't take too much of that pain medication.
Okay.
I don't want you to be uncomfortable, but if you take a lot of that and take it all the time, it'll make you constipated and crazy. A bad combination.
Yeah,
so try and withstand a little bit of discomfort from time to time. Just take some soap on your finger, and go like this once in a while.
Okay.
See, it'll push a clog through the valve. There's a one-way anti-reflux valve there.
Yeah, but I know I'm draining, quite a bit, and
Well, it is more than we'd like to see, but it's not anything serious.
Okay.
All drainage will stop.
Right.
This looks fantastic. Stand up here for me. I mean, what a flat tummy, huh?
Oh, the tummy is great.
Christine is just doing great. That drainage is to be expected because we've undermined a wide area. You know, it's about this long and about this wide. So it's not unusual to have a little oozing there. It's nothing serious. She's doing fine.
I love the results. I mean, even with, you know, there's a lot of swelling still, but the results are just, I'm so excited. And I was hoping the drains would come out today because they're kind of uncomfortable and you can feel them. You know, they're in your back, so it's kind of hard to turn from side to side. And so other than that, I'm real excited. I'm just, you know, I'm anxious to get the healing over with so that we can start doing the fun stuff.
This documentary is a chronicle of the internal journey of the participants, as much as it is of their physical changes. Self-image psychology suggests that the perception a person has of himself or herself directly affects self-esteem, ability to enjoy intimacy, and even overall happiness. To find out more about this, we talked with Professor of Psychology, Dr. William Swan, at the University of Texas in Austin, Texas, and with Professor of Psychology, Dr. Sarah Angulo, at Texas State University in San Marcos, Texas.
Self-esteem is your overall opinion of yourself. You base that opinion on a collection of things. So you might feel that you're very talented at your job. You might feel that you're great with people. You might feel that you have a whole host of other talents. If you are keeping all of those in mind, any aspect of appearance may become less important to you, and you might say, I'm a great person, I like myself overall.
Self-image is particularly image of one's attractiveness is highly correlated with self-esteem, which is also associated with happiness. So it's a little bit of, there's some difficulty in figuring out what causes what, but we know that all three of those things, self-image, self-esteem, and happiness, are associated.
My self-image was very low. My self-esteem was very low. I had just gotten out of an abusive, horrible relationship that I was in for about 5.5 years, and I wasn't feeling very good about myself.
When I was at my highest weight, I did not go out at all. I missed a class reunion, which I had never missed one before, but there was no way I was going to go, feeling the way that I felt about myself.
After a huge weight loss, there is just an amount of wreckage on the body. I mean, it's just, I do not know how I would ever have reconciled that. I think every day I would have gotten up and dealt with, but you look fine in clothes, or no one's going to see that, or it doesn't really matter. I'd be giving myself a pep talk every morning for the rest of my life, and it eliminates that.
Self-image is a part of happiness. It's not the only part. If a person has a good self-image, it's no guarantee that person will be happy. Likewise, there are plenty of people who might not feel the most attractive, but are happy people.
I put my clothes on today and I look at myself in the mirror every morning and I feel good about how I look. I feel good about who I am.
After the surgery, I started going out, I started dating, and I didn't feel like I had to settle for anybody, and now I'm dating a great guy and I couldn't ask for anybody else better. So it definitely has an effect on your relationship status.
Well, I'm quite pleased. And I'm pleased because I like the way I look better. I feel certainly more in tune with the middle age I am.
I had to make some sort of change. I had to change the way I looked, and then that just changed how I felt about myself and allowed me to just open up. And I'm so happy now. I'm laughing all the time. I'm smiling all the time. In fact, I've actually had several people say, you have this perpetual smile all the time.
Physical looks also affect the way the rest of the world treats us, at home, at work, and in our social lives.
As far as societal expectations for image, there's a lot of research in evolutionary psychology showing that our desire for an attractive mate is possibly universal, specifically when it comes to men desiring an attractive female mate. They did a study covering over 20 cultures showing that men in almost all cultures valued things that were indicative of youth, large eyes, small mouth, youthful face, breasts, and an hourglass figure. All of these things indicate fertility and that a woman is young.
You have dating sites now. You look at pictures, you make a decision whether you want to go out with somebody based on a picture. And if the picture doesn't look good, you overlook it and go on to the next.
The facelift, it made my face fresher. It made it, I don't want to say happier, but it made it less sad. If like sagging means sad, it kind of looks sad when people are down like that. So it just brightened things up. It really brightened things up a lot.
Well, he thinks I look great, but he thought I looked great before, although I begged to differ with him. So, I mean, now he kind of calls me his trophy wife. So it's a big compliment to me.
Well, there's a huge emphasis on looking youthful, and that's closely associated with attractiveness, particularly for women in our society. So society says that unless you conform to a fairly narrow range of body types and physical architecture, like as in Victoria's Secret models, then you're deemed unattractive. And so it's not good news for people as they're aging.
People say, especially women, when you get to 50, you're kind of in the lost group. You know, you're getting too old to attract younger men, and then the older men are looking for the younger women. So you're kind of in that group where you're lost. You can't get anybody unless you look good.
Men are very visual, so when you're out there dating, it makes it where, you know, people can't believe my age. I actually kind of play with it as a joke a little bit when I'm out, and that they guess my age to be mid-40s, and me being 58, and that I just totally shock them. So it's actually a great feeling.
If you look at the evolutionary psychology literature, and I think if you just think about things generally, everybody wants to look healthy and vital and young to an extent, right? And so men also feel that pressure, especially because men know that having a certain look or behavior can get them ahead in their careers. Men who are concerned with status would absolutely think about things like this.
So I decided to have a facelift in order to help my career as far as gaining clients and being competitive.
Work status, my boss uses me to go market our job, and so I go out to different insurance agents and different insurance companies and talk to them, and of course, you know, the pretty girl always stops and they'll talk to you. You can get in the front door that way.
My career certainly has turned into a very positive, both financially and in its success as I continue to build my business. I have much more confidence in my appearance, and know that now my 100% focus can be on what my product is, what my service is, and not so much worried about how I look or how they're going to perceive my weight or my disposition.
Initially, I was very concerned about having the surgery as far as results go, because I certainly didn't want to be pulled tight. I didn't want to look as if I had plastic surgery.
Many people make changes every day in their life, and career changes, diet changes, marriage changes, and this was the most positive change I could have ever made for myself.
3 months after the total experience, I was totally satisfied because I felt that I didn't look like I ever had plastic surgery.
All 3 of these patients have gotten really good results. Part of that is because we pick patients who have something we can treat and are pretty well going to have a nice result.
2 people could have the same surgery and have objectively equally good results, but they could feel and think very different. Their internal clocks and barometers could be vastly different. This is a classic idea in psychology. It's not necessarily your actual situation, it's the way you are perceiving it.
3 months after their surgeries, we talked with Jessica, Trish, and Christine to find out how they felt, about their experiences, and about themselves. As you will see, they had very different reactions.
I would tell somebody else that they're thinking about getting plastic surgery, go do it. You're gonna feel 1,000 times better after you're done, and you're just gonna have a completely different outlook in life. You're gonna have so much more self-confidence. And don't do it for other people, do it for yourself, because you're gonna feel great.
If someone came up to me and asked me what I would recommend about plastic surgery, I would tell them never, ever, ever have plastic surgery. Be happy with who you are, accept your flaws, and don't do it. That would be my advice.
Sometimes I think, would I do it again? No. And sometimes I think, would I do it again? Yeah. You know, look at how good I feel and how much more confidence I have. I just even notice how I walk anymore. You know, I just kind of got maybe a little bit more pep in my step. So in the end, it's all good. It just took a lot out of me, and it was my last summer before my son started school, and so I was a little disappointed that I wasn't able to do some of the things I wanted to do with him.
I can't wear a sundress. I can't wear a bathing suit top. I can't wear anything that shows any type of cleavage because my breasts are 2 different sizes, and it's so noticeable. I'm very, very tall. I have a very long torso. When you look at it, I mean, even, you know, it's funny because even people that don't know me very well, the massage therapist noticed right away.
So as far as the original expectations of being able to be in the boat and wearing a bikini and being on the beach, none of those things panned out. But in all fairness, the stomach. So as far as the original expectations of being able to be in the boat and wearing a bikini, and ask yourself the simple question, what's the worst that can happen? And if that worst outcome does occur, can we live with it?
Well, the surgery itself, I wasn't actually scared of going into because I always knew I wanted it. It was just the actual recovery that I was iffy about, but everything was like I expected. I knew I was going to get pain, and that's what I got. I got lots of pain.
As the summer went on and started feeling better, it took a lot longer than I expected to feel good again. I would say I'm really just now starting to feel good.
And with the tummy tuck, it got rid of a lot of my stretch marks, and I'm just so much more confident. I could show my stomach. I could actually wear a bathing suit now. It's been great. My sister used to make fun of me a lot. She used to tease me that I was fat and everything. But now, I mean, she's asked me to borrow my clothes, and we go shopping together, and we wear the same size. And it's funny because she's younger than me, and we're wearing the same clothes. She was really amazed of how everything turned out. So she doesn't say anything anymore to me.
Criticism can absolutely change the way we feel about ourselves. Self-esteem or happiness with the self isn't just this stable little thing that we carry around inside of us. It is based, at least in part, on what other people are telling us about ourselves. It's like we use other people as a mirror that we're looking at, and we learn from what they say about us. And so if someone is constantly criticized for any aspect, appearance or otherwise, it can have a very negative, long-lasting impact on self-esteem.
It's often the opinions of others that prevent people from being happy with their end results.
I think it's one of the consequences of plastic surgery is that it really focuses people's orientation toward physical appearance.
I didn't expect to look like a 20-year-old. I just wanted to feel good about myself again and look normal again and get rid of the skin and some of the other problems that I was having.
The support that we get from our close others is probably either the major or certainly one of the major sources of self-knowledge. And so throughout our life we really rely very strongly on support for our conceptions of self from those other people. And so at a time when we're undergoing change, which is intrinsically frightening to people, that support becomes even more important.
You know, of course, Cameron's just couldn't believe it because he was gone for a couple weeks, about 2 weeks, way back right after the surgery. And when he came back, he just was like, wow, I can't believe a lot of the swelling had gone down during that time. And I mean, I just remember seeing his eyes pop out of his head kind of type thing. So that was neat. I guarantee you, I look better now than I did at 18. So I'm really happy.
Now I feel great. I have more confidence. I could go out. It's just so much better now. I feel like a rock star.
She was beautiful before, but now she's like 10 times better than what she was. And just the way she feels, the way she acts now, it's completely different. It's amazing. I love it.
People have an image in their mind, and it might be a beautiful sister that they're trying to not compete with, but trying to look like. And so their expectations are very, very high. But you know, all we're doing is trying to get people to near normal. Perfection eludes us. Perfection is made from trifles, but perfection is no trifle.